We're now going to talk about Skill 2, which is verifying the content of a controlled substance prescription and DEA number. For this skill, you have 6 minutes. Via this event scenario, the competitor will be given a prescription. Each competitor will also be given a prescription verification form, which acts as the rating sheet. It is page 16 of the guidelines. The prescription in the scenario will have missing information. Competitors must know all the required components of the prescription in order to identify which components are missing. The prescription verification form will be scored by the judges using the points indicated. We would like to show you a full prescription that has the information that is required on the prescription. You can see there is patient information, which includes their name and address and might include their date of birth. There is prescriber information, which includes the prescriber name, address, telephone number, and license number. There is also a DEA number, which we will cover in more detail in a few moments. Also on the prescription, you must have the month, day, and year the prescription was prescribed, the drug name and strength, the dose and quantity, the route of administration, the directions, which is marked by signature or the abbreviation SIG, the number of refills authorized, the product selection was permitted or was required to be dispensed as written. Then you need the prescriber's signature, and there must be no dangerous abbreviations, acronyms, or symbols as pointed out by the Joint Commission's minimum do not use list and the Joint Commission's recommended do not use list. The second part of the skill is the DEA number verification, which are assigned by the Drug Enforcement Administration and are used to track controlled substance. There is a method that we're going to use to determine if the DEA number is valid. Step 1 is to verify the second letter of the prescriber's DEA number corresponds to the provider's first letter of their last name. So our prescriber is Smith, so the second letter should be an S. Step 2 is to add the first, third, and fifth digits. So we have an 8, a 2, and 6. We sum that together and we get 16. Step 3 is to add the digits in the second, fourth, and sixth spots, and then to multiply that sum times 2. So digit 2 is 5, then we have a 4 and a 1. It adds together 10. We multiply it by 2 to get the answer of 20. Now we sum in the next step, step 1 and step 2. So we add 16 and 20 together and we get 36. That last number of 36 is supposed to be the last number of the DEA number. So John Smith's DEA number ends in 6 and 36 ends in 6. So this is a valid DEA number. Now you also need to look at the prescription again to make sure there are no invalid acronyms, dangerous abbreviations, or symbols. And if there are any, you need to record what they are. If there are not any abbreviations or symbols that can't be used, you write no. And then if there are any other actions that are required, if you had to call the doctor about something, you would write in there, doctor needs to be called. Otherwise, you can say there's no actions necessary.